this is how I do a torsional release for people whilst they're sitting. And the majority of times I do the torsional release while they're sitting. It's just easier. So I tend to use my thumb, or you could use your fingers, but I tend to use my thumb because it's the bit closest to me. And just tell me when it's sore. Is it sore about? Is that sore?
Yeah, just there.
There, I can feel there's a little trigger point here. Almost everybody has some tenderness under their neck. So I have my finger firmly on the sore area. Now, I'm keeping my finger, I can feel the thickness, the tension that you have in a trigger point under my thumb. So turn your head gently this way. Does that become more or less sore? More sore. Okay, so we're going to come back now, and now we come the other way. Is that less sore?
It's pretty good now.
It's pretty good. Now, if it wasn't, there was still some pain, what I'd do is I'd just explore every angle that I needed to. So I'm moving there. I can feel it just get softer under my finger, and that's about it. That feels good?
Mm-hmm.
Okay, so it's not rotated fully. Now take a deep breath in and breathe out. Lovely. And I'm going to rotate back, and you tell me if it starts hurting.
A little bit there.
There, okay, so we come back here to the point that it feels. That's comfortable.
Yeah.
Take a deep breath again and breathe out, and just look to your right. Is that sore?
No, that's good.
Oh, very good. So it just turned off like that. Very quick. So that's one. Now we'll just come back and we'll go all the way. Other way. Does that start hurting again?
A little bit.
Okay, so take a nice deep breath and breathe out. Look to your left and just... Is it still sore?
Still a bit.
Okay, so let's see. Take a breath again and breathe out. Oh, I can feel it. So just tilt very slightly. We want to make sure that everything stays pain-free. Oh, there we are. That feels nice?
Mm-hmm. Yep.
Okay, and is that still sore?
Still
sore.
Yeah.
Oh, okay. Okay, try this way. Still sore?
No, that's good.
Good, okay. Good. So we just come always back into pain-free zone. And so now let's see if we can tilt your head slightly. Is tilting making it sore?
No.
Ah,
That's
very good.
fine.
That feels good now. Okay. So now put your head back. Is that sore?
No.
Good. And put your head forward. Is that sore?
No, that's okay.
Fantastic. So let's just move your head around. Is it sore when I do anything?
No, it's okay.
Fantastic. There you go. Throw away your walking stick. I'll just talk through what I'm going to do. I'll search for the trigger point, or the painful area, the painful muscle. I then am going to explore where, remembering that the muscle itself is not just straight but is a spiral. I'm going to explore how I can turn your neck and move it around until the muscle itself goes quiet, the spasm goes, and that is a point of rest for your muscle. So I will rotate this way. Now sometimes as you rotate that way, even though the muscle is being stretched, it's actually unwinding. It's a kind of unpredictable thing. So I never know which way I'm going to turn your neck to find that position of rest. So sometimes I turn this way and the muscle just goes quieter. Sometimes I need to tilt like that, and I just search for the position where the pain has gone. Once it's gone, the thing that I can feel is that the tense muscle under my thumb or under my finger, if I was doing it with my finger, just melts away. And I'm in this position, and then I just gently turn, and I'm now going, because previously with your neck, as I went this way, it actually got worse. So I'm now in the point of comfort, and I now explore all the ranges of movement, making sure that the neck pain doesn't turn on again. I'm keeping ischemic pressure, so I'm keeping acupressure on the muscle itself, which is part of why the technique works, because I found it's gone quiet, there it's quiet, and as I move, I'm keeping pressure on it, so I'm desensitizing it right throughout the range of movement. If we get to a point here, often I'll come back, and then it's just a technique. I'll do a little wiggle, which is something that the original person who showed me torsional releases did. Sometimes that works beautifully, sometimes it's not necessary. It wasn't necessary the first time we did it, because it turned off so quickly. And then I reach that limit, interestingly coming around and reaching full range of movement the other way turned out to be the most difficult one to turn off. And all you do is you just gently work until it's gone, and then backwards, forwards, and around. So, and you make sure that you have a full pain-free range of movement, and then often I will settle people down with a wheat bag with some heat and ask them to do, and show them what to do, and do a self-treatment, and then they go away, do a few self-treatments, and the whole thing settles. It's a really quick, efficient, precise, and painless way of treating necks.